Top story, and quit smoking. That's the call ahead of this World TB Day this year. It's coming up on the 24th of March. That's because smoking increases the risk of dying from TB up to 9 times tuberculosis. It does, of course, remain the biggest cause of death in the country as well. The National Council Against Smoking is also asking for stronger tobacco control policies. So 2 big issues to discuss and how to execute on that. Well, it's a huge pleasure to welcome the Council's Sharon Nyatsanza to ENCA this morning. Sharon, good morning to you. First of all, World TB Day, it's coming up 24th of March. The call, as I said, quit smoking. For those who are not medically trained, help me understand what the link is. It seems like an obvious question, but I don't think people realize what the link actually is.
Yes. So, the call for us for this World TB Day is to quit smoking. Because when someone quits smoking, they reduce their likelihood of getting TB in the first time, in the first place. So when someone smokes, they actually double their chance of getting TB. And when you are smoking and taking treatment at the same time, this makes TB treatment less effective. This actually also increases the risk of recurrent TB and the likelihood of dying from TB. So quitting smoking for the TB population group is very, very key. So our main call is quit smoking and reach out to the National Council Against Smoking to help you to stop smoking.
Where are we in the fight against TB in this country, Sharon? Because as part of my intro as well, you would have heard me say it's still the biggest cause of death in South Africa, and there are continuous programs. We celebrate World TB Day. There's organizations, government departments, NGOs, NPOs, everyone trying to do their best to get on top of TB, yet it's still the biggest killer. How are we not getting on top of this, in your opinion?
So, the challenge that also comes with TB is that it's actually very, very related, as you know, to HIV. So most of the TB deaths are actually also linked to HIV. So the challenge that they're currently trying to run after is to try and get everyone on TB treatment, and that is a challenge because there are still missing cases, within the TB community. So, the biggest challenge is to try to get those people on treatment and to ensure that they actually also complete treatment. And this actually is also linked to tobacco use and to alcohol use as well, because studies are showing that people who actually are also smoking are actually less likely to adhere to TB treatment. So, even though there's all these factors as well, quitting smoking is very important. So the WHO actually also calls for integrating tobacco cessation within the TB programs as well to make them more effective.
Let's talk about those prevention measures and those quitting measures. There's also a call, I understand, for stronger tobacco control policy here in South Africa. Unpack that for me. What does that mean, Sharon?
Yes. So, of course, we always call for tobacco cessation. And if the public calls 011-720-3145, they'll reach the National Council Against Smoking Quit line to help them stop smoking. But we're also calling for stronger tobacco control policies, because this actually also goes hand in hand. So we also call for, the finalization of the tobacco control bill. This is not the solution, obviously, but this is a big step in trying to actually make the environment more quit-friendly. So the measures that these laws actually introduce are actually designed to make it easier for people to stop smoking. So, for example, when we make the public indoor spaces 100% smoke-free, this actually has been proved to actually increase quit attempts by people who stop smoking. But again, our main aim here, again, is try and protect the next. So this is part of the campaign that we are having with the Heart and Stroke Foundation and the Cancer Association and the South African Medical Research Council. And a big part of this is protecting the people who don't use tobacco already. We're trying to encourage them not to start in the first place. So all these, tiny bits of measures actually contribute to the overall role to promoting the health of the nation and for this World TB Day to try and control and stop TB.
Sharon, just before I say goodbye to you, I'm afraid I missed that telephone number you gave me. Perhaps someone watching just wants to get hold of or use that telephone number again. Can you give it to me nice and slowly, please?
Okay, so they can call the National Council Against Smoking at 011-720-3145. Or they can send an SMS and we'll call them back. Or even send a WhatsApp message on 072-766-4812. So even if you go to the www.againstsmoking.co.za webpage, you also get access to this number. And the good thing is this number is actually also on every cigarette package in the country.
Okay, so those who do smoke will be able to find those numbers as well. I thought just worth you repeating those numbers for me. Sharon Nyatsanza, National Council Against Smoking, talking about the importance of quitting smoking, especially in the fight against TB, which is World TB Day this coming Wednesday. I think that's the 24th of March. Sharon, thank you very much indeed for your time.